to our first episode of the medical case of Jesus Christ. And I am Dr. Victoria, and I'm here with my fellow doctors.
Dr. Elieshiupendo.
Dr. Neema Balige.
Yeah, so in this particular episode, we're going to discuss about Jesus as the healer. But before that, let me try and assess your thinking. Have you ever analyzed or thought about the death of Jesus Christ? As in why did he die? Because the Bible tells us how he died, but we do not know truly what killed Jesus. Do you even know the intensity of the blows that he received during the point of crucifixion? Or as well as when it comes to him him just demonstrating his healing powers, do you think it was supernatural, or is it something that can be explained medically? These are all the things that we're going to be analyzing throughout these episodes. But first, as we say, in this first episode of Jesus as the Healer, we're going to discuss on the episodes, or rather the times when Jesus healed in the scriptures. We know that he healed actual diseases, and there are medical cases that have been reported. So let us talk about the issue of blood. We have heard of this woman that had an issue of blood for almost 12 years. So what exactly is that? And if it was happening in the world of today, Dr. Elieshi, what would you as a doctor would have done?
Thank you very much. It's interesting because Jesus healed several conditions or several diseases. And for example, in the medical field right now, we could be diagnosing them either as symptoms that the patient experiences, or the signs that we see that they've been experiencing. But so, for example, for the woman with the issue of blood, generally we could term it as menorrhagia, based on the signs and the symptoms that she has, or the accompanying signs and symptoms that she has. But actually, there are several underlying causes, or there are several things that could be accompanied with the issue of blood bleeding for 12 years. In reality, or in real sense, having a person bleeding for 12 years, it's quite a long time. And there could be several factors or several things that this person could be having. Either she had an inborn condition or a congenital condition whereby the bleeding factors are not working properly, or she's lacking some bleeding factors to help the blood to clot, or she has low platelets, therefore her blood cannot naturally clot, so she's bleeding continuously. It could be a hormonal issue. It could be malignancy or cancer. It could be apart from malignancy, it could be like a benign tumor, or a tumor that is causing her to bleed profusely. So there are different things that could be causing her to bleed, you see. And then there are complications that this person has, bleeding for 12 years. You expect her to be anemic because she's losing a lot of blood. You expect her quality of life to be poor. To be poor or to be low, substandard. Why? Because she's tired all the time. She has headaches. She has low blood. We expect her heart not to be functioning very well. Yes, and then we expect her kidneys not to be functioning very well. So we expect this person for 12 years, bleeding profusely, non-stop, to have suffered a lot of complications. Now, Jesus being able to diagnose that, because right now we depend on imaging to be able to diagnose. We depend on the laboratories to be able, like you take a sample of blood, you have to go and check for the hormonal issues. You have to go and check for the bleeding factors that she has the clotting factor, You have to check for the bleeding time. How long does it take for her to bleed? So we right now in science and technology era, we depend on a lot of things to be able to diagnose. Yes, a lot of tests. But Jesus being able to pick it without there was no laboratory. or if there was, it was not documented. But being able to pick it without taking a sample in the laboratory, being able to pick it without taking her for imaging, maybe an ultrasound, a CT scan, being able to pick it without doing further investigations or other accompanying investigations to confirm a diagnosis, that is quite supernatural. And we see Jesus healing this person. How did Jesus heal this person? Because the Bible tells us that she had gone to several doctors, or she had gone to physicians, and she was exhausted. I mean, she has exhausted all her funds. She has exhausted all her everything that she had, because she wanted healing. You see, now for all. And for what she did, she just said, if I would only touch the hem of his garment. So we see that she, one, did not pay for consultation. Two, she did not pay for any investigations. And three, there was no any medication that was given during that interaction. Only Jesus said that your faith has made you whole. So there are several episodes, as said, or there are several conditions or diseases, but this one, it's just, wow, it's really supernatural. Yes, it's really supernatural.
And you can see that there are so many physiological changes from what you explained. There's so many physiological changes that this woman went through for at least 12 years. And she had to cope with that. Dr. Neema, what do you think were other associating symptoms? Because I am so sure it wasn't just her bleeding, but also apart from that, how would you as a doctor treat her right now if she comes in and presents with such a symptom?
Okay, thank you very much. So, as Dr. Eshi said, this woman will be presenting with, most likely, will be anemic. So, we usually transfuse depending on the level of the hemoglobin. So, we need to stabilize this woman depending on how severe it is. So, I'm assuming, I don't think if during those times blood transfusions had already been invented. I'm even wondering what medical treatments they used to do when she was visiting those physicians, because most of these things were not yet invented, as we give these blood products, the way we actually take them to the blood bank and all the process, screening of these various diseases to the transfusion. All these things had not yet come up during those times. So I don't know how she was able to survive, if it's other means such as food or things that she was recommended by those physicians by then. But at this point, one is to stabilize her. So she'll be anemic, and you treat according to the underlying issue. So if it's a clotting factor that she needs, she'll be transfused, We have they'll give them in form of plasma or cryoprecipitates, which have a high concentration of these clotting factors. So that will be the first things. But also, if it's a hormonal issue, that is also depend. So you also treat depending on the hormonal imbalance that she has that is causing the bleeding. But if it is cancer, that is also another long story, because it has all these complications, and as she said, the quality of life will really be impaired. So it will depend on the cause. If it's cancer, we have all these issues of chemotherapy, surgery, radiotherapy, which is all so invasive, and it impairs you a lot. Yes, it impairs you a lot. So it depends on what was the underlying issue. So they would go, if it was a cervical issue, endometriosis, if it was, some of these would require hysterectomy, and other medications to stop the bleeding.
So they would reach the hysterectomy part, for those who don't know, that the removal of the whole uterus. So that means this woman, if she doesn't have a baby, she's not capable of having a baby. But apart from that, I also think about her probably also experiencing crampings as well, because when you have pain, it's just another level of discomfort. So I can imagine this woman went through a lot, and I can't even imagine a person seeking for help for 12 years from different doctors and they're unable to help her. Like, that's the highest level of frustration. So we see the supernatural healing of Jesus Christ. But apart from that, Dr. Elieshiupendo, we're seeing Jesus also healing people with leprosy. So many people have, we can see so many cases of the lepers. I mean, the story of the 10 lepers and other people who had leprosy, they were healed from it. But I do not think people understand the intensity, or rather how leprosy used to affect a person's quality of life, because it's not common right now. So maybe you can tell us a little bit of what leprosy is.
Yeah, thank you. So leprosy is an infection, and also it's a result of inflammatory reaction. But actually, it's an infection caused by a bacteria, Mycobacterium leprae. And it has different stages, or we have different clinical stages. Like there are 4 stages. We have the indeterminate stage, then we have the tubercular stage, and then we have the 3rd and the 4th stage, which goes to total lesions. Now, depending on the stages, depending on the stage this person has, you can reverse it, or it could be non-reversible. So, for example, if a person is on stage 2 of leprosy, the tuberculoid, which is as a result of the immune reaction towards the bacteria, it could go back to stage 1 when a person is given steroids. For example, the example of steroids, dexamethasone. So, if a person receives steroids and the antimicrobial therapy, the correct antibiotics for that, you can reverse it. And then when the person goes to stage 3, stage 4, these are severe lesions. And it could also take a miracle to be able to go back to stage, to be leprous free. And the Bible does not tell us exactly what causes leprosy. We see in the Old Testament that these people had leprosy as a result of a curse. If they committed certain sin, and then they would be punished, or God will curse them with leprosy. Example, Miriam, when she went to complain about against Moses, God punished her with leprosy, and then she was put in the camp outside for 7 days, and then she was healed. She was taken back in the camp. But we see that for leprosy, a person cannot be healed within 7 days. The science tells us that this person will need treatment for at least 6 months to 12 months, you see. So we see the healing power of God, as much as we're discussing about Jesus Christ, but we can also see the healing power of God, for example, in the Old Testament, where Miriam was healed after 7 days. But when we come to the case of Jesus Christ, again, being able to treat, because we said that it's a bacterial infection, and it can also be transmitted from one person to another. And people would be taken outside the camp because they have leprosy. So, Jesus was not afraid of leprosy, because right now, if I was brought a patient with leprosy, I would have to put on the appropriate protective gear, to protect myself from getting leprosy. But we see first the compassion of Jesus Christ, or the love of Jesus Christ. He did not need to wear the protective garment when he approached the people. And then at that time, it was not known if it was a bacterial infection. The result was, or it was only as a result of a curse or a punishment. And then now, in our case right now, because we have a lot of resistance, because right now, if a person has just a little cough, they take antibacterials. If I have an ear pain or my ear is itching, I put antibacterials in the ears. If I have acne, I take antibacterials, I apply on the face. So anything that it's abnormal symptom, we take antibiotics or antibacterials, antimicrobials. So we expect to have a lot of resistance. Yes. Now imagine having to treat leprosy in this era of antimicrobial resistance. You have to treat, and the treatment usually go for 6 to 12 months. Now imagine you have to treat it for more than that time, because most of the drugs or medications are resistant. Plus, you have to do a triple therapy, or you have to do a combination therapy so as to help, antibiotics and steroids, to help that person to minimize the immune reaction, one, but also to have maximum benefit from the antimicrobials. But Jesus coming to a person who has leprosy and then being able to tell them, you are healed, go and show yourself to the priest, it's quite supernatural. Because for me, I would need to take biopsies from the lesions. I need to go to the laboratory to study the lesions, but also to confirm, and then I would also need to treat that person and need to follow up on that person for 6 to 12 months. And in the case of Jesus Christ, he did not need to follow up on the people with leprosy, nor the woman with the issue of blood. Yes.
It is a very, very intense disease, because we even say that leprosy is a flesh-eating bacteria. So it means that the bacteria actually eat your flesh.
Yeah.
And it even affects your nerves as well. So there are some studies that show that people even become blind because the nerves are affected, depends where it is affected you. So it shows that it's a very intense thing. Now, the question comes, Dr. Neema, do you think you would identify today that Jesus is a doctor?
That's a very nice question. So today, in today's world, for someone to be termed medical doctor, because there are many doctors, the world nowadays, social media and everything, there are so many sort of doctors, There are car doctors and all these other funny doctors. So a medical doctor is actually, in today's world, is supposed to be qualified, certified, depending on which country, on the country rules and regulations. But there is a process that takes one to become a doctor. They need to have the knowledge behind it. They need to have understood so many things, in the medical field. They have to go through this whole medical degree, understand the anatomy, the physiology, and all these things, and how to prescribe medications, how to diagnose. So in today's world, well, I don't think they would call him a doctor per se, based on the scientific terms, based on the medical terms, that we have, because he did not go through any, medical degree or medical course that, the doctors should go through. So he would not be identified confidently that he's a doctor or is certified to be a doctor and actually practice, So from the medical perspective, no. However, he did miracles, and we know that he did things beyond the whole science and the medical field. So he practiced healing, and we usually say that as doctors, we actually treat, We do not say that we heal. We do not actually heal, but we treat, we treat patients so that they can get relief of whatever they are suffering from. So Jesus is a healer, but speaking medically, is he a doctor? According to the medical terms, no.
Yeah, I thought that is very interesting, because when you even think, or rather look at the methods that we would use to heal the people that had incurable diseases, you would see he would use different methods. While for us doctors, we have specific ways. Like this works, so we're gonna stick with this. But with Jesus, he just used different techniques, so you can't even claim that he used the same method to treat. Wow, that was a very interesting conversation. I really enjoyed it. Thank you so much for joining us. I'm sure you have learned and explored as much as we have regarding seeing the healing aspects of Jesus, and we have concluded that for us as doctors, we just treat, and Jesus truly heals. Thank you. See you next time.